Hello everyone, welcome back, and this is Dr. Sita with you again. During pregnancy, there are various doubts that go through the minds of people who are pregnant and also their relatives regarding many things, and especially regarding the sleeping positions. Which positions are best, which positions are to be avoided, how to get up from one position and move on to another position, etc. etc. In this video, I'll be demonstrating the different sleeping positions in pregnancy, which positions are good, which positions are to be avoided, how to get up from the bed, how to lie down on the bed, etc. with the help of one of my staff nurse, Nisha. I'm sure that after watching this video, most of your doubts regarding this particular issue during pregnancy will be cleared. So stay tuned and watch this very informative video till the end. We are all creatures of habit. We like to do many things in a certain way. We like to eat certain things. We get upset or angry when we hear something. Something irritates us. Something makes us happy. We like to sleep in one position, be it prawn position or dorsal position or on one side or the other side, whatever. And it's very difficult to break out the habits which we are used to or accustomed to. So, the moment we realize that we are pregnant, it's just not possible to break out of those habits which have been with us for a long time and then get into a new habit in one single day. The change happens only slowly, and there is no hurry also, especially regarding the sleeping positions. During the first 3 months, the uterus is a pelvic organ. It cannot be palpated through the abdomen when you do a per abdomen examination. So, during the first 3 months of pregnancy, you can sleep in whatever position you have been used to and in whatever position you want to. You can sleep in the dorsal position, you can sleep on the right side, you can sleep on the left side, you can sleep on the prone position, and you can even sleep on the prone position with one of your legs bent, etc., whatever way you want. The baby will not be smashed between your tummy and the cot. Nothing will happen to the baby. However, after 3 months, the uterus slowly starts growing up, and by around 5 months of gestation, the uterus is just below the umbilicus and it can be palpated per abdomen. From this time onwards, one has to be careful regarding how one sleeps. Not only that, how one gets into the bed and how one gets out of the bed, etc. I'll demonstrate each of these things. From around 5 months of pregnancy, it is best to avoid the prone position, that is lying down on your tummy, because the uterus will be compressed. Also, it's best to avoid the dorsal supine position, that is lying down straight on your back facing the ceiling. What is wrong with this position? When you lie down on this position, the big blood vessels like aorta, inferior vena cava may be compressed by the growing uterus. And compression on these blood vessels is not good because it may reduce the blood flow. Hence, it's best to lie down on one side and preferably to the left side, at least most of the time, if not all the time. There are 2 reasons why it's advisable to lie down on the left side. The first reason is when you turn to the left, the compression on the inferior vena cava, which is on the lower side of the right side of the abdomen, will be reduced. The second reason is the gastritis, gaseous distension of the abdomen, nausea and vomiting sensation, everything will be reduced to a great extent when you lie down on the left side. During pregnancy, as most of you know, there is increased incidence of these symptoms, especially due to hormonal changes and also pressure by the growing uterus. Sometimes, even when you lie down on your left, you experience nausea, gastritis and gaseous distension, etc. and you are not able to sleep properly. What do you do then? There is one thing which you can do. You can prop 2 or 3 pillows and lie down in a semi-reclining position for some time till these symptoms subside. There are many people who find it difficult to turn completely to one side and sleep. For such people, there is a shortcut. What you do is you lie down straight first and then slowly turn a little to the left side, prop a pillow behind your back on the right side, and then prop a pillow beneath your abdomen on the left side. So in this way, there is a slight tilt of your abdomen to the left, which will reduce the compression on the big vessels and will also reduce the gaseous distension. For reducing the gaseous distension, you can use that propped up pillows also and then sleep like this. If at all you want to change positions, you want to change from the left lateral position to the right lateral position, what do? During daytime, when you are lying down just for some 20 minutes or maximum 1 hour, what you can do is you can get up and then turn to the other side. But during night time, if you want to change positions and if you try to sit up every time you want to change positions and then turn to the other side, then your sleep is going to be disturbed, and disturbed sleep is also not good during pregnancy. So during night, what you can do is, if you are lying down on one side, slowly turn to the central position and then slowly turn to the other side. And of course, you can use the pillows as I mentioned before. Many a times, women experience cramps in the legs, especially the calf muscles during pregnancy, and edema in the feet also. And sometimes women are troubled due to varicose veins and they experience aches, other discomforts, etc. What you can do when you experience such symptoms is you can sleep with a pillow tucked between both your legs. This will bring at least some amount of relief. So I hope you understood the various positions in which you can sleep during pregnancy. Now, when you lie down on the bed and when you get up from the bed also, you should be careful. You should not lie down on the bed like this. This is not good. Instead, you should lie down like this. Also, when getting up from the bed, especially in an emergency or when someone is calling you, you should not get up in a hurry like this. Rather, you should get up like this. Some women are used to sleeping without pillows because they are having back pain, neck pain, or due to whatever reasons. They can continue to do so. There is no need to start using pillows just because you are pregnant, especially for the head. But you can use those other pillows, that is on the side of the tummy, behind the back, in between the legs, etc. Many women experience back pain during pregnancy. This is because of the hormonal changes which relaxes the ligaments, etc. and also because of the change in curvature of the spine. And many women suffer from back pain even before pregnancy, and for such women, the back pain gets aggravated during pregnancy. When you have back pain, it's best to avoid soft bed. Either sleep on a hard bed or you sleep on the cot if you are used to sleeping like that. And another thing which I want to tell you is it's not at all compulsory that you should sleep on a cot or a bed. You can even sleep on the floor. In olden days, many people used to sleep on the floor only. But be careful not to sleep on a bare floor. Spread a mat or a thick bedsheet and then lie down. Pillows, etc. use the same way as I mentioned before. Before ending this video, I would like to mention one more thing. If at all you want to sit up for some time, read something or do some meditation, prayer, etc., it's best to sit on the bed with your spine straight, with the back supported by a pillow, rather than sitting on a chair with your legs down, because most of the time by evening your legs would have swollen up and your legs would have started aching and there might be cramps also. So it's best to sit like this with your spine erect and with a pillow on your lap, and then you can read, meditate or do whatever you want. You can even keep a pillow in between your legs for more comfort. Women who are carrying twins, triplets, etc., and women who have got polyhydramnios, that is increased amount of fluid in the amniotic sac, all experience these issues to a much greater degree. Their legs ache more, they have more of edema feet, etc., etc. The same principles what I've explained in this video apply to such women also. So I hope that most of your doubts regarding the various sleeping positions during pregnancy, the various do's and don'ts have been cleared by now. If at all you're pregnant, please do use this knowledge gained, and also please spread this information among your family, friends and contacts. And for that, you know what to do. Please do share the video link with your family, friends and contacts. Till I see you again with another video, take care of yourself and your loved ones and stay blessed.